All right, welcome to the Daria Hamrah podcast. This episode is an episode that I've been looking forward to for a long time, just because the person I'm about to interview and introduce to you means a lot to me, not just professionally but personally. And he's one of the mentors that changed the pathway of my life and my career, and who I'm very grateful for, and I'm here today to honor his legacy and to share his story with you, and so hopefully that he can inspire you just as he has inspired me and many others that he taught and taught um, and just whether they were his students, his residents, or his family members. Now, Dr. Robert Marx is the person who I'm talking about, and he is one of the legends in the field of oral and maxillofacial surgery. And for those of you who don't know what oral and maxillofacial surgery means, it means the specialty that deals with the mouth, jaw, and the face, which is a very niche specialty. And if you've ever gotten into an accident and you've broken a bone in your face, or you had a tumor or a lesion in your head and neck, or you had to have your wisdom teeth removed, or you had a tooth replaced with a dental implant because of a traumatic loss or an infection, you have probably heard of an oral maxillofacial surgeon. But Dr. Marx is not just a surgeon. He's not just a surgeon. He is an educator. He is a mentor to the profession that has been kind of overshadowed by the medical and dental community, because it's a hybrid specialty. And I want to take this opportunity to also introduce this specialty to those of you who are not familiar with it, to show you how our specialty has changed many lives and has changed many other specialties, their approach to medicine, and is something that has started really after the World War and was developed by dentists in the early 20th century, if I'm not mistaken. And Dr. Marx was one of the pioneers in many treatments and many science technologies that oral maxillofacial surgeons use throughout the world. I remember the day my career started was about 1999, and prior to that, even as a dental student in Germany, I heard his name oftentimes, and as a matter of fact, I thought he is German until I realized that he's actually American, back then when I was in Germany. And the day that I decided to come to America for my continuing education, for my residency, one of my colleagues and students who had been into an oral maxillofacial residency in Germany, he told me that I should go and train with him. And I asked him how he knows Dr. Marx. He says, "What do you mean? You don't know him?" And mind you, I was a dental student and I didn't know much about the field yet. But I remembered that conversation, and then fast forward in 2003, I commenced my residency and trained with them. So a little story here, a little pretext to what's to come. I want to thank you, Dr. Marx, for having me tonight in your lovely home and with your lovely wife. And we're here in your man cave, I believe. And
that's what I call it, yes.
And so I came to do this interview in person just because of the meaning that it has to me. And I also took a trip down memory lane before I come here. Like I told you, I went to Jackson Memorial Hospital where everything started, and I was talking to Francisco and sharing some of the crazy stories. But my stories are just a blip in your career, which started when at University of Miami.
That was 1984.
1984, and so now real quick, just before we get into the University of Miami, I would like you to tell the audience how you got into the field to begin with, and what inspired you to become an oral and maxillofacial surgeon. And I believe you're from Chicago, and how did all of this evolve? How did you become the person you are today, and how did you start your career?
Probably a longer story than I have time for, but essentially I went to Northwestern University Dental School. The first day I stepped in there, there was a meeting of the oral surgery group, and they were presenting cases that they got from Cook County. And there was the icon at that time by the name of Orion Studeville. Studi, everybody called him. And he was lecturing and basically pimping, as we called it, the residents about the function of the kidney, the function of the liver. And I was like, what does this have to do with dentistry? And then he related how it had to do with the jaws, and the same blood that was flowing through the liver goes up into the jaws. And it kind of inspired me at that time. This is a profession, a specialty of dentistry that makes a big difference in patients' outcome. And I followed through with that. That was one of the kickstarters, if you will.
So that was your inspiration. That was the first contact with the specialty for you. Now, from that day on, did you decide this is what you want to do? Did you have a plan, or did you kind of like fall into it? Tell people how everything started from that point on. Did you have a mentor? How was it?
I didn't have a plan. Things fell into place. The years in dental school, as you know, you go through other specialties of dentistry to get through graduation. But then it really matured when I went into residency. And went into residency, the same place you did, was the great Dr. Klein. And Stuart Klein was a rough-talking ex-football player, but basically a teddy bear underneath. And what he established was a freedom to do a lot of advanced procedures. Now, Dr. Klein, he's an All-American football player at that time from University of Pittsburgh. In fact, he's in the Hall of Fame. But what inspired us, and it's not just me, it's other individuals, is that he was a center for University of Pittsburgh. And what he did there, what does a center do in football? He blocks so the quarterbacks and running backs can get all the glory and score the touchdowns. That's what Dr. Klein did for me. People like Joe McCain, who's a well-known individual in our specialty related to TMJ. He blocked for us, never took the bows. He allowed us to become the kind of people we are today. Always a gratitude towards Stuart Klein.
So I had the fortune to meet him, and rest in peace wherever you are, Professor. So I totally know what you're talking about, because I had the fortune to meet him. And I think mentorship starts early on, where there is a spark that inspires us and that shows us this limitlessness. Now, for you, was he the inspiration? Was he the one that showed you perhaps that anything is possible if you put your head to it? Because I know his character. He was a very strong. He had a strong character. He never took no as an answer, and nothing was impossible. And he questioned everything. And how much has he influenced you? Because to me, looking at you and your career, I would dare to say you have outgrown Dr. Klein. But of course, a lot of it is his influence. But how much of it do you attribute to your own drive? Because what you did, frankly, and many know, is that you changed the entire field. Your contributions, I mean, there's too many for me to mention. I have to do a separate intro for that, which I will. But for sake of time, I left that out. What was your drive? Did you ever look at things the way they occurred, or did everything just happen and fall in place? And if so, what do you attribute it to?
I attribute it to three people. I've always said there's three people that really kind of gave me direction and taught me how to be a leader. Also took advantage of opportunities. Now, the first one would seem kind of odd. It was a super skin diver named Gary Branham. He was the the most celebrated skin diver when I was a dentist at Ramey Air Force Base in Puerto Rico. Here's a guy that shouldn't have paid any attention to a young diver like myself, but took me under his wing, and we eventually became the spearfishing champions of the Caribbean in 1972. For him to stoop down to my level taught me that this is what we should be doing. We need to teach young people like yourself when you start as a resident who have that potential and give them that opportunity. The second one is the one I've mentioned, Dr. Klein. What I learned from him is that you don't have to take the bows. You need to put your trust in well-educated, trained people and let them score the touchdown, so to speak. Let them develop and become the greatness that they could be. Now, the third one is when I left my residency and fellowship, I was still in the United States Air Force. I went to Wilford Hall Medical Center. There was a Robert P. Johnson, who's my best friend today. He was the Air Force commander. What Bob Johnson did is he supported us. It told me that if you're going to be a leader, you have to support your faculty and the people under you. He would write the best evaluation reports for us and got me into the research opportunities that were at this base. And at his retirement party, I think I said something that summed up Bob Johnson completely, is that when an Air Force officer tells you to do things, you bust your butt for them. You do it because it's an order, it's a military order. For Bob Johnson, people like Frank Dalwick, one of the best people in TMJ ever, and myself and another fellow named Doran Ryan, who's a very excellent cleft lip and palate surgeon, we busted our fannies for Dr. Johnson because we didn't want to let him down. That was a big difference in being ordered. So each one of them contributed to what I put together as how I can lead a division and bring it up to the highest level possible. I took a lot of the research opportunities that we had at Wilford Hall, animal lab, a hyperbaric chamber, animal and human chambers, worked with several people. It honed my skills. We then started what I became known for, and that's recombinant human bone morphogenetic protein. We did all the animal studies there and started even some of the human studies. So one of the things I would tell any of your listeners is take advantage of the opportunities that present. There's not too many you'll get in life, but the ones you get, really hone in on them and make something of it.
It's funny that you just said that, because I think I told you when we talked several months ago in Orlando that very trait that you just described, not letting your mentors down.
Yeah.
It's almost like it's a culture that once it's ingrained in you, you pass it on to the future. It's almost like a legacy that gets passed on. And one of the things that every day I go to work, I have the same approach and the same feeling, almost that inner voice. Not that I have to force myself. It's actually a pleasure. It comes natural for me to do the same, having in mind your influence. And for me, knowing where it comes from is the first time I hear that. So it's very interesting, because that's how I go to work. It's about making you or any of my former mentors, for that matter, proud, because without that, it's we won't really be who. What's the right word? Without that, it's almost we can't be true to ourselves. Yeah, it's almost the only way for you to be true to yourself is this very trait that you talked about. And
yeah, to add to that, one of the things that I smile about nearly every day is that the individuals that I have contributed to their training have all become very successful. Right now there are 7 or 8 department chairmen. Some have achieved notoriety, like Eric Carlson and James Melville, and I could name a couple others. And then the individuals who went into a private practice have also, with our help, changed the whole face of oral and maxillofacial surgery. When I started, we were just learning orthodontic surgery. Now oral and maxillofacial surgery is the go-to specialty for oral and head and neck cancer. It's also eclipsing plastic surgeons in facial cosmetic surgery. We are also very dominant in dental implants. So the profession has expanded, it's improved, and I think we've made some contributions to it. So that is part of the legacy. I like to say it's a goal achieved.
Yeah, yeah. So and that's the thing. I mean, that's there are big shoes to fill, and there's a huge responsibility when you bring a specialty to a point where you have to pass it on to the Millvilles, to the Carlsons, who they might be. How do you prepare for that? Meaning, when you picked your residents out of all the hundreds of applications, do you ever think about when you pick someone, because how many did only 3, right? 3 per year, 3 residents per year, and then 2 interns?
It turned into 4.
Turned into 4. I mean, I'm right now receiving applications for fellowships where I see so many there. I mean, they're all great. It's hard to pick them.
Indeed. And
So
a lot of times you
it's
miss
so hard
good
to pick them.
candidates. Yes.
And so, what do you base? What are like 3 traits you looked for when you picked the candidates, if anything, or did you just go by feeling? Did you go by intuition?
The way we did that was to look at their applications first. And we wanted to see, do they have an increased trend in their grades and in their evaluations? Now, I didn't look too carefully at the references, because everybody writes good references.
Right.
It really then gets to be the journalistic ability of the person you ask the reference. So a lot of it boiled down to the interview. And in the interview, we look, number one, trustworthiness. And as you know, as a resident under our residency at Jackson Hospital, a lot of times you're operating by yourself. You're making tough decisions.
You are.
We had to trust them that they would make a good decision and not try to cover up any shortcomings that went on. So that was one. I wanted them to be trustworthy. I wanted them to be able to, trying to here now look for this, the right word, to be able to learn quickly. Because as you know, we get thrown into the deep end really, really fast. And I want to find out, do they really care about the profession, care about their patient, rather than do a cookbook procedure and then just
But
wash
how
your
do you
hands of it.
find that out?
By
That's what I'm struggling.
asking the right questions. You do it sometimes. So I would ask them during the interview a question they wouldn't expect. They were always asking, other people would ask questions about oral surgery. I asked them about dentistry. Did they really learn class 3 prosthodontics? Did they really learn the difference in periodontal inflammation versus traumatic inflammation, things like that? Did they learn that? Then I knew the person was a decent learner. And yeah, you get a little feel by their body language. We're looking for enthusiasm. But those are the 3 traits that I wanted: is trustworthiness, a passion, and an ability to care for people.
I'm glad I asked that question, because I'm sure you don't remember our interview, which, by the way, was one of the toughest interviews I've ever had to conduct, because it was one of the longest interviews, and I was actually very sick. I had just arrived to Miami from Chicago, and we went out and had sushi the night before, and it was this place by our hotel, which was far actually, which was in Sunny Isle Beach, because that's the only place I could find that I could afford. And so we went to the sushi place in the middle of the night. It looked very sketchy. So I ate and I got food poisoning.
Oh boy.
And I was really sick. I had 102 point something fever. It was above 100.2. I was completely nauseous, and I remember we were sitting in that room where we had our morning rounds, where we were like waiting, and they brought like drinks like Coke and water and Sprite, and they offered me to drink. I was scared to drink because I was trying not to throw up, not to vomit, because that's how sick I was. So
I think I remember you were sick.
So I was very dehydrated and then when I came to that office, that corner office that you were doing the interviews, which wasn't actually your office, I came in. It was a very small office. I felt very claustrophobic because I was sick. And here you are asking me, and I had done head and neck cancer research at Harvard before I went to Chicago in cell cycle analysis of carcinogenesis of head and neck cancer, which is what got me interested in head and neck cancer. And so I knew a lot about it because I had devoted 2 years of my life into basic science research. And so when you asked me what I had done, I just brought that up. I never thought you're going to dig deep into the cell cycle analysis of carcinogenesis. And I was really sick. I didn't feel like talking. And here you were asking me about the molecular pathway of carcinogenesis from the time carcinogen hits the cell membrane, and then what happens at molecular level. And I'm thinking, what is going on? This is an interview for a surgical residency. He's talking to me. So now I know what you were doing. You wanted to make sure whether I learned, what I know what I'm talking about, or whether I'm just, I don't know.
Well, not only that, you were accepted to the residency because I don't remember, sensed that this is a guy that can do well under pressure.
Yeah.
And we are under pressure. I don't know if you remember, I usually ended up with telling the candidate, this is oral and maxillofacial surgery in the fast lane. It will tax your academic ability, it will tax your physical ability, and it will actually tax your psychological ability to handle stress. Are you up for that?
Yeah.
And that's what you kind of apparently performed, and we were happy with that. So, but that's really true. As you know, in Jackson, you're called at 2 o'clock in the morning, and you can't whine about it. You have to go there and treat a patient. Some of these patients are drunk, they're spitting at you, they're bleeding. It's sometimes a semi-chaos.
Yeah.
You have to deal with a difficult situation.
Yeah.
And I dare say the residents that we accepted always performed well under that type of pressure. That was a great comfort to all of us.
Yeah, I was just telling my friend Francisco here that I came to Miami as a boy, I left as a man, is because of exactly what you talked about. And before coming to Miami, I was at Mass General, I was at University of Illinois in Chicago, then I did an internship at Loyola. So I had done 3 prior stints before I even started my residency. So not that I was confident but not cocky, because I knew how much I'm going to learn. I was really excited. What I didn't know, which was very humbling, as a matter of fact, was intimidating, when I started my residency, because I thought that it's going to be great, but it was a rude awakening, let's put it that way. And for the very things that you just mentioned, in the middle of a night, you're treating a mandible fracture, drunk guy, he's spitting blood in your face, he's even kicking you or punching you.
Sometimes,
and here you are trying to help him. I had never seen anything like that. Or tumors we treated that, I remember the very first day we had our morning gathering where you greeted the new residents, and when you said, here in Miami we do what people read about, and I thought about it for a second, but then I remembered this thing here. I have to pick it up, which is pretty heavy.
Oh my God. My book.
This is one of the biggest books. Actually, it's the biggest book I have in my library. So this is the book that you wrote, which is now the Bible of our field of oral maxillofacial surgery. I put it down here.
Yeah, that book we've got a lot of pride in. That won the Medical Writers Book of the Year award in 2002. So that
which is considered, and I know you wrote it, but I consider it the Bible, and I have it. It's one of my most often used references in my library, and there is a story to that. That's how I actually met you first. I don't know if you remember. I was an intern in Chicago, and I had applied to the program and to your program, and of course I didn't get accepted. I was considered a foreign graduate coming from Germany, so I knew my chances are very dismal, but I just threw a Hail Mary. And so I was in Chicago. I was presenting at the midwinter meeting, I believe it was in Chicago, and you were at the Quintessence stand doing book signing for this very book. It was in 2002.
Yeah.
And so I'm like, great, let me go at least shake his hand and just tell him who I am and tell him that I would love to come and interview. And I looked at the line. There was like 20 people in line with a book, and someone told me, well, you have to buy the book. I'm like, how much is it? I remember it was
close to $400.
It was $400, and if you bought it there, it was $50 off, so $350. And I'm like, geez, I don't have any money, but I need that book because that's the Bible, so I need it anyways. So I'm just gonna get it, and that's a perfect opportunity. I can shake his hand and he's gonna sign the book for me. That's all I want. So I stood in there, and as I stood in the line, I realized there were some of the surgeons that I interviewed for other programs. They were in that line. Just for the audience to frame, the picture here. And so we said hi, and you signed the book, and I said that I would love to come to Miami. And you took what impressed me about you is that you took your time. You didn't just brush me off. You took your time to get to know me, who I am, and why I want to come to Miami, and what I'm doing currently, and what I've done so far. So it was a mini interview, to the point that I got uncomfortable because I know there's 20 people waiting to get through the line, and I kept looking back, and people kept looking like, what's going on there? Why is the line not moving? So it was very uncomfortable, and that moment, to me, just for the audience, it really depicted who you are as a person. That one of the things I always tell people, because they come and ask me, hey, how was it training with Dr. Marx? Because whenever, being considered as an authority and a legend, and people really have this picture of you that you're this old, mean, grumpy surgeon that's always yelling at people. And I'm like, no,
not. Yeah.
He is the nicest teacher, most genuine teacher that I ever had. So to the point that I always strive to be like him as a teacher. So, but that, it became to me apparent at that moment, because you didn't have to do that. And what you did at the end when I told you everything, I don't know if you remember that. You told me, write your number down, and I will talk to Mark, which was Dr. Stevens.
Mark Stevens at that time.
He was the program director.
Yeah.
You said, we already concluded our interviews, but our picks for our interviews, but I will talk to Mark and tell him to get you in. And this was like October, and you already had interviews planned for November, December. And I didn't know what to write, and I'm like looking around, and again, another gracious move, and he saw I'm uncomfortable. He took a piece of paper, he tore a piece, and he gave me a pen, and he said, what's your number? He wrote my name down, he wrote my number down, and put it in his coat pocket, and there I go like, geez, he's probably gonna lose that piece of paper. I'm never gonna hear back from him. And a week later, Mark calls me on my cell phone. Is this Dr. Hamrah? I'm like, yes, who's this? It's like, this is Dr. Mark Stevens. And the rest is history.
Yeah.
And so it was because of that moment. And so to me in life, many things have to lead to each other. We're defined by the decisions that we make. And that day I made the decision and come say hello. And you graciously took your time. And,
well, see, that's a learning experience that I had, because I was brushed off too as a dental student and such at Northwestern and a couple places that I applied to. So you don't want, when you have problems and you're facing now on the other side, you remember that. You don't give people short shrift, and so it worked out well for you and for us as in the program, and that's the way you need to treat people. You take a look at residents, whether it was you or anybody else. You're not students really. I mean, you're men in your late 20s and early 30s, and one of our goals was not to treat you condescendingly, but to treat you as equal partners that just have less experience. That when we went in the operating room, we were co-surgeons. It wasn't really faculty down to student. Dr. Klein had started that, and that's one I wanted to emphasize and ask Mark Stevens to do that, and all of the other faculty since. And that's how you can basically hand over the scalpel to somebody and let them do the surgery under your supervision because you trust them.
To that point, and because when I came to Miami, I'd been at prior places. Rarely the residents got the knife.
Yeah.
Pretty much you were always watching. That was one thing that I was very, very surprised training with you. And I wasn't even a chief resident. I wasn't even a senior. I remember I was first or second year, and we were at Deering, Jackson North, Jackson South, and we're doing I think that was a pectoralis major flap, and I remember you handed the blade to me, and I thought you made a mistake because the senior resident, I think it was it was Stern. I don't know if you remember him.
Mm-hmm.
And
Mike Stern.
Mike Stern, and he was very nice, by the way. I hope he's.
He had done a number of them by then,
Yes.
so let's let the second year resident,
Yes.
the junior resident, do the surgery.
So he handed the knife to me. I thought it's a mistake, and he's like, "Okay, go ahead, cut." And I've come from places the chief barely cut, and so I just started cutting, and he let me do it. I kept doing it. I'm like, okay, at some point, I hope he's going to take the knife away from me because I have no clue what I'm doing.
Well, we were guiding. We had
Correct.
a clue what you were doing. At
I know.
least.
I'm
That's the most
exaggerating,
important part.
but the beauty of that's where I learned the technique of teaching.
Yeah.
It was like, as I was cutting, he was like a book talking to me, explaining what I'm doing, why I'm doing, what to look out for, and that's where I learned the principles of this is how you teach a young surgeon, and that's the only way you can learn is if you get to do something. You can't play the piano by watching or reading a book.
Exactly.
You have to hit some keys, and to me that's the distinction between the Miami program and all the other programs. No disrespect to the other programs, just how they were run, and that to me defines your legacy. Anybody that asks me how was it training with Marx, I tell them the story.
Yeah, you know, I had lectured in the LSU board review course and of course the Denver board review course. A lot of our residents went there, and every one of the residents that we had who talked to the other residents taking these board review courses were absolutely astonished that our residents were doing the surgeries and were doing that level of surgery. They said, you guys are really doing this? Yeah, we kind of do this every day. You know, taking a posterior hip, taking a pectoralis major flap, doing a cancer surgery, doing a neck dissection. We had the technical skills to do it, but it was people like Dr. Klein and even me who fought for the privileges to do that. And I dare say, patients are better off having an oral and maxillofacial surgeon do those procedures that maybe ENT would do or maybe a plastic surgeon would do. Our results, maybe I'm being parochial here, always were better. Patients had a better outcome. Patients were more satisfied with our post-operative care. You know, that's something I just, again, smile about almost every day when I think about it.
Now let me ask you a question. Do you remember every single resident or fellow that you've trained? Or is it at some point it gets
Probably
blurry?
not, but most of them, no, they are all a blur because I have, 20 some in the United States Air Force that I trained. Yeah, if you would mention their name, I would remember them. Offhand, I could probably, give you the first 100. But what's interesting, there's an individual story about each one of them. Like you're relating some of your stories. I could tell you the stories about Marco Morales that would go on and ever. The stories about Keith Jeffords that we just talked about and such. But you got to know the residents on a man-to-man basis and even a man-to-woman basis because we've had several ladies in the program. It was just good to know a little bit about their home life and what they went through to get to where we are.
And what does it mean to you when you see your residents succeed or fail for that matter? I know you don't know about every single story of your former residents or fellows, but does it make you feel a certain way when you really see them? How do they compare for example, to seeing your children succeed or fail? And how do you, is it similar? Is it totally different? And tell me about that.
It is similar to the residents, and almost all of them have succeeded. It's the same as my children. I have three sons. One's a dentist, one's an orthopedic surgeon, the other one is a chief vice president in Ryder Trucking, does all the fuel management. I'm very proud of my sons. I'm very proud of all of the residents that I've trained, that I know how they have succeeded, and they've all been really great, either academicians or they've been great contributors to their community. So the answer there is a simple word. It's called pride. Now, we have had a couple residents who passed away, and believe me, that hits you deep in the heart. You literally cried. I can think of one who overdosed on drugs. He got into the drug problem. One who crashed in an airplane crash, and then another one who passed away from cancer not too long ago. Your heart goes out to their families and the like, but since you knew them personally, and they died before their years, these are not people my age who are passed away. These are younger people. They had a better life even ahead of them, and had a good life that they created until that tragedy. So yeah, those hit you hard, and you get depressed for a couple of days about that.
Not to get too depressed, what is your fondest memory of your teaching career? I mean, I know you have many memories, but is there a memory that is really like meant a lot to you in your teaching career?
It would be disrespectful to just single out one.
Of course.
Because almost all of them, one of the ones that kind of shine out, I mentioned Eric Carlson before. I was the one who sponsored him through medical school. He wanted to go to medical school. He was on the faculty. I saw that he had a lot of greatness in him, and so I was the one who put the robe on him at his graduation. That was special. And then when I saw James Melville do his first lecture on microneural grafting, that was special. But they're not that much more special than a lot of the others that I've seen. When I visited Randy Landis and saw his practice, he's just in private practice, but how everybody in that room, fellow dentists, were really respectful of him. That's just as good as it gets, literally.
Yeah, I mean, as far as I'm concerned, that's one thing that I always think of is the legacy we pass on. I think there's something to be said about how it makes us feel, because to me that's the motivation and that's the drive. Those moments, those are the proud moments. And talking about James Melville, I heard him talk the first time in Orlando, and he blew my mind. I mean, one of the greatest speakers at this young age. And I remember he was. When I left, he was the incoming resident.
Oh, yeah.
And so, it was funny, but because he told me a little story, which I'll tell you later. But that is, I can see what you're saying with being a proud moment, because it's like watering a seed that turns into this amazing.
But it's a baseline that almost every resident has been a major contributor to community, has elevated profession. When I look back, when I started Oral and Maxillofacial, 1974, it's a different profession. Sure. It's gained the respect of medicine. Right now, oral and maxillofacial surgeons become part of the American College of Surgeons, whether they're a single degree or a double degree. So the respect we've now gained and earned from the medical profession is something I have great pride in. From when we started to what it is now, we've made major contributions. For my own sake, the ones I brag about is the research into hyperbaric medicine, the research into platelet-rich plasma. We put that on the map. And PRP now is used more commonly in orthopedic surgery than it is in oral and maxillofacial surgery.
Even in plastic surgery and aesthetic medicine.
Oh yeah.
For hair growth.
Hair growth, and
I
guess
use
what?
it in my practice all day.
For ED.
Yes.
Some of the people are using ED, which personally makes me cringe, but
but
it's being used for that.
It works, and it works.
And then we've done recently tissue engineering, and of course, it was Animal surgery for BMP, it was 3 FDA-approved studies to get recombinant human bone morphogenetic protein, a big long name, on the FDA docket. I presented it to the FDA. It was unanimously approved. That's been a game changer in our profession. It will grow bone where you want it to grow.
So what was for you the turning point in your career? What was the game changer in your career? Because you have all these milestones, all these contributions, and each one of them is, historically legendary by itself. And but to you, I'm just curious to know, to you, what was the turning point in your career, in your opinion?
Oh yeah,
Was there one point, or
there's no doubt there's one point, and it may be a little bit of a long story. It happened in January 1971. I was a senior dental student. My father and I were walking. We had parked our car. We were walking to the Chicago Stadium to see the Chicago Blackhawks hockey. I was assaulted, and the interesting story is the guy comes in front of me and says, "I want you to give me all your money." And of course, I'm a senior dental student. I got $9 in my wallet. I kind of just backed off a little bit because I was shocked more than anything. Before I could even do anything, 2 guys grabbed me from behind. They were trying to get my wallet out of my back pocket. I grabbed him by the hoodie and pushed him to the side. He came off the car and punched me in this left side. My father, who was head down, walking ahead because it was bitter cold and windy in Chicago, came back and they had left. It happened very fast. A 1-block walk to Chicago, I was dizzy, and my dad said, "We better take you to the hospital." I found out that I was stabbed with a stiletto. So I'm in the hospital at Cook County that night.
That's where you want to be in trauma.
Yeah. Well, I'm young and healthy, but as it turned out, they missed a diagnosis. My entry wound was nipple high in the left chest. Anyway, I was discharged the next day, Monday. I'm calling my dental school friends. I got into a little bit of a tussle. I was stabbed, apparently a flesh wound, and I had a rigid abdomen.
So on the left side?
On the left side. I had a rigid abdomen, so I never missed a rigid abdomen when I was in the emergency room myself.
Sure did.
Anyway, so I talked to my friends. I'll be back in school Wednesday. I then, that night, I apparently, it hit my spleen ruptured. So I had an acute abdomen. I was living with my parents. I crawled down the stairs and my legs went out. My dad found me, got me to a hospital, and 8 units of blood later.
Oh, wow.
Almost a total splenectomy. The surgeon left some in. So anyway, so I survived that. I went to Chicago mug books after I recovered. I couldn't identify anyone, and the detectives told me that it's a useless thing because all of his buddies that lie, even though I could identify, I never identified anyone. But what it did, at that time, I was accepted to the Mayo Clinic for oral surgery training. Because I got in the hospital debt, I had to renege on them. I called them and they were very we know you got in a situation, we'll take our next alternative. And I was already given a dispensation by the United States Air Force to go get oral surgery training. So they said, well, you're going to have to now go overseas because all of our assignments are out as a dentist. Which is, okay, fine. So they sent me to Ramey Air Force Base in Puerto Rico. Okay. So from a near life-ending situation, I go to Ramey Air Force Base. I meet my future wife there, who was a school teacher. Now, 49 years later, we're still together with 3 kids. We've been compatible and in love for that whole time. So it turned out well.
Talking about turning point.
That is a turn, and it doesn't end there. There I met this first fellow, Gary Branham, who I learned how to be a leader from. If you have a lot of accolades and you're a big deal, don't hesitate to teach the people under you. That is almost an obligation. From there, I ended up in Miami because, again, I had to reapply. The Air Force sponsored me, so Dr. Klein, who was always interested in saving money, I saw me as a free resident. So I don't know if he accepted me on my so-called merits, but he accepted me on the merit of, hey, I don't have to pay this guy.
Whatever works.
It did work. And then, of course, Dr. Klein and I became great friends as well as great respect. So here, again, a near life-ending episode turns out to be one of the best things that ever happened to me. got me to the right place with the right person, wife, kids. It all fell into place there. So
Wow,
that was a turning point.
That's quite a story. I'm glad I asked that question because I didn't know all that.
Yeah, yeah.
And so how did you get into cancer surgery? And also to you, the reason why I'm asking that question because people ask me why do I do cosmetic or plastic surgery, and I tell them that I really struggled with the emotional aspect of cancer patients, and I'm a very emotional person, so I really took their tragedy, it affected me, because I felt in a sense helpless, because some cancers we diagnose, and
Yeah.
I remember this young girl, 16-year-old, who had a salivary gland tumor in her palate, and I think it was an ACCM. I don't remember, or a muca. I don't remember what it was, but she passed away 6 months later, and it really, I said, I knew then that I can't do this. I'm not cut out for it. I was too emotional.
That's what everybody has to say. What subspecialty? I was, because I was relatively scientifically oriented. The way I got into it is after my residency, which was 3 years at that time, I applied to the American Cancer Society for a grant. So we were doing bone research with Marco Morales. He was my assistant there. But
I've read those articles.
Yeah, I scrubbed in with the general surgeons who were doing the head and neck cancer at the time. They were good surgeons, but they were really disinterested. So, and they didn't know the anatomy of the neck. Finally, I said, I know better than these guys, and I didn't want to tell them that. But if it wasn't a thyroid, they were disinterested. And of course, to them, being physicians with no dental training, cancers of the tongue and of the tonsillar pillar were messy to them, and they didn't want to deal with it. So basically, handed it over to me. So they tutored me a bit, but basically, it just let me go learn on my own a lot. And so by the time I graduated, I had done enough cases, 50 or so, from nearly start to finish, to basically be credentialed in it. So that's how I got started, and then I honed my skills when I left there at Wilford Hall Medical Center in the military.
Now, that's the one thing, and it's interesting to know how you got in there. But the one thing I'm trying to wrap my head around, you're a person that is you strike me, and I know you. You don't strike me. I know you as a person now. You're a very empathetic person. You're a very compassionate person. How do you handle, or have you handled cancer patients throughout your career? Because a lot of times there's no happy ending.
Yes.
And as a person with your compassion and empathy, how did you handle it? How did you come home some days, and how did you deal with that? I don't know, the word is suck it up, or you try to be objective. You can't help the future patients or that one that you lost without being objective. No doubt, the ones that you thought you could cure that got away from you, they haunt you a little bit. What you take solace in is that when we started, the overall survival rate, 5-year survival rate for head and neck cancer, if you take all comers, was 50%. When I retired just last year, we were at 70%. 20% increase in that time period is remarkable. A little bit of it's due to better surgical instruments. A lot of it's due to better training and what we contributed on reconstruction. If you have to remove a little bit more tissue, we could do that to get a safe margin, rather than, if we take this off, we'll never be able to reconstruct it, the person will be deformed. Wow. The one that gets to you most are the teenagers and children who you don't save. There's a couple that I have had tears in my eyes, that we tried our best and we lost them. A lot of them just had incurable type of cancers. And I can see why the highest suicide rate is in pediatric oncologists. They deal with that all the time. Yeah.
So, yeah, it takes a special person, it takes a special person to be an oral and maxillofacial surgeon to begin with.
Yeah.
Not everybody can. And so you kind of, in almost a Darwinism thing, you gyrate to the one area that you can handle emotionally and technically as well. Whether it be cosmetic surgery, where you have that detail and the ability to deal with demanding patients.
Yeah, I mean,
Yeah.
to me it was cosmetic surgery because I found out about the joy to make people happy. You know, what I do every day is to make people happy and give them their self-confidence back. Now, one might brush it off as superficial, you're not saving lives, but I feel I'm changing lives, and to me that makes me happy, and just like it makes my patients. So I was just curious to see how you handle that.
Yeah, no, and I agree with that. I think that you make people not so much happy, but confident in their life. They can go on feeling better about themselves if they look better, whatever their image of themselves. If you improve their
100%.
self-image, it extends into their family and how they deal with their family.
100%. And to me, that was what I realized, that I can make a difference, even though I'm not curing cancer, which is why I started my journey. And ironically enough, I'm on the other end now.
Yeah, when I lecture to a group of dental students, I tell them oral and maxillofacial surgery is the single best specialty you could consider. And one of the reasons is you can do anything. If you want to strictly do dental implants, you can, and you'll make a good living and a good contribution to the community. If you want to do just wisdom teeth, you can do that. If you want to do what we call orthodontic surgery or surgical orthodontic, just do it well. You will make a big difference in people. If you want to do what I do, cancer, bone grafting, TMJ, and I've never been good at TMJ, that is a big contribution to that person. And you know what? No specialty of dentistry, no other specialty of medicine can do it. We do something that is unique. So have pride in being an oral and maxillofacial surgeon.
I 100% agree with you, and I tell the same thing to every person I talk to. I say, we have the best specialty in the world.
Yes, we do.
Period. Let's pivot here a little bit. Now, all your contributions aside, everything good that happens in our lives and in your life comes at a cost. Because honestly, nothing is for free, you know. Everything has an upside and a downside. What is the cost that you feel now, looking back, reflecting, that you paid for your career?
People would say, and I'm not saying this, people might say, well, when you're in academics, and even when I was in the Air Force, we accepted a lesser salary. And we accepted a greater amount of hassles than somebody in a private practice who has control of what they do. That was never a big issue. When you get into academics, you realize that you're going to get hassled by the school, and you're going to get hassled by insurance companies even more than if you're in private practice, and your salary is going to be less. The biggest cost that I paid for it was, and it saddens me greatly, is returned from University of Miami Medical School and seeing that much of what we built to be second to none was trashed out because of political correctness and what I think today people call woke. Meaning that what I bought into when I started University of Miami was their mission statement. And the mission statement said, we have 3 things that we hold sacrosanct: patient care, resident education, and research. And we stuck to that. That's been changed. Now it's diversity, inclusivity, and transparency. This nebulous stuff that you can't really define. And so we were accosted literally by that, to the point where they didn't want us to do IV sedations, which, you know, you're going to be shocked at this. The Department of Surgery Chairman, Omaida Velasquez, didn't know anything about dentistry, argued about that. She thought it was unsafe, and we presented all the data about the safety on it. And basically I had to tell her, look, we are required to do these, or else the program will not be accredited. And she didn't care, so I had to defy her on that. I said, we're going to do it anyway. We just have to, or else we're going to lose the program. Facial cosmetic surgery, what we always took pride in at the University Jackson Hospital System, is we could do anything we were all trained to do. And I had 2 faculty that were trained in cosmetic surgery. She forbid them to do facial cosmetic surgery.
How much of it do you feel was turf battle versus ignorance?
100%, well, let me say 80% ignorance, 20% jealousy. It had nothing to do with turf battle, because this is the Department of Surgery. We, as a division, were one of 17 other divisions. Other divisions were trauma, plastic surgery, hyperbaric medicine, elective surgery 1 and 2, all of those, thoracic surgery. I was unequal. The problem is that we became more well-known than the Department of Surgery chairman. So she had some jealousy for us, and despite the fact that we were the #1 financial program in the whole department, we were in surplus every year. So there was this animosity that grew for no apparent reason. And so when I left with a great deal of sadness, because she fired my secretary, she fired the chief nurse, and almost everybody in our clinic.
It's like
for reasons that
she
we
went
heard.
rogue. She went rogue.
Went woke is what the term is. So we're all doing better now. I'm right now in my career have done my own podcasts. I'm doing a lot of webcast education. I'm going to take on a position to run a head and neck cancer institute at Mercy Hospital.
Oh,
so,
fantastic!
Yeah, I'm looking forward to that.
News.
Just sitting
I didn't know that.
The new thing is that HCA, Health Corporation of America, asked me to develop a head and neck cancer institute second to none.
That's wonderful.
And that is, they said, look, we want you to build what you had at University of Miami. What they meant by that is remove the cancer, work with oncologists, work with radiation therapists, and rebuild the patients with your bone grafting techniques, put dental implants in, get them teeth. So sort of total rehabilitation, not just reconstruction.
So you're like Tom Brady coming out of retirement. You're
yeah.
unretiring.
Yeah, I just hope I don't get sacked.
You're unretiring. That's fantastic.
I am unretiring. It's still in the works right now. And one of the two motivations I have for this, to be honest with you, is one of my fellows is going to be the chief of that division. I am basically helping him get set up and recruiting the right people. The second is 2 big-time stem cell researchers have been recruited. People I know, we're already planning some exciting studies.
That just made me really happy.
That's, at my age, that was something that would draw me out, other than a big fishing program.
To me, you retiring would be a biggest waste of, or disservice to, I don't want to exaggerate, but I'm not, mankind. And when I heard that you're retiring, I'm like, it's way too early. So much more that he can do, he can contribute.
I think I can.
Although I understand the price that comes with, because, there is fishing, there is family, there is relaxing, but what is your drive? Like, what makes you go to work every Monday after all these years? That's what I'm curious about, and that's what probably a lot of the audience wants to know, because you could be riding into the sunset.
I could, but I'd be bored to do it. So a little bit of it is boredom, but essentially, it's, as I said, we started this program. There's an opportunity out there. There's an opportunity to make another contribution that will be significant, and one of the things of leadership too that I didn't get a chance to mention is, to be a success, you have to surround yourself with great people with great ability, and you have to support them. That's what those 3 people, Bob Johnson, Stu Klein, and this Gary Branham, taught me. That's how you become a success. It's not all you. You have to put your trust in people who can make you look good as you support them. And so doing it all over again, and I hope that there's one more contribution left in me.
Well, it's I don't know if my next question will have relevance now, because I know everything that we struggle with in life comes with an opportunity and a lesson, right? So you were just talking about all of that. To you, what's the biggest lesson you learned from your biggest failure?
Well, I guess my biggest failure, I didn't think I had failures until this issue came up with the University of Miami, which is politically driven, you know, and so my failure is not realizing that when you're in a medical school, as well as in a dental school, there's always backstabbers, there's always people who are jealous, and you have to realize that's nothing personal. It's like the mafia. When they knock somebody off, it's not personal, it's just business. It's just they want a different approach. And so what I learned from that is you can always pick yourself up and do something great again. And that's what we're doing now.
That's wonderful. I mean, I'm personally very excited. I'm great. I'm really grateful that you did not hang up your cleats yet. So I'm really excited because I was really not sad, but again, I guess bummed is the word.
Well, make no mistake, I still go fishing.
Okay.
When I can. I mean, that's my passion. And,
what type of fishing do you do? Deep sea fishing? What type of fishing?
I do two types of fishing. I have a boat in Key West, and I go out and I fish the wrecks and catch snappers and groupers and have great fun. But it's an opportunity to do a lot of that with my sons.
Wonderful.
They are been my skin diving partners, my fishing partners, my football game partners this whole time. So that's part of it, and then every year I go to Canada once or twice and fish freshwater fish. And that's from my youth. I did that when I was a young person and still haven't gotten that out of my system. And what I like about that, and I'm applying to the ocean, a lot of it's what's called CPR fishing. What that means is catch, photo, release. You don't.
I thought you were resuscitating the fish.
Yeah, no, I'm not resuscitating the fish. Mouth to mouth to a northern pike, that could be bad.
Yeah.
But the point is, like the fish in Canada, you catch a 20-pound fish, he's 25 years old. So if you keep a lot of those, the fishery isn't going to replenish itself. So you release them unharmed, and they continue the genetic line, and the fish industry stays at a very high level. It's great fun.
Wonderful.
It's
So
my idea of fun.
So do you have a habit? What's the one thing you wake up in the morning and you have to do no matter what? Like, do you have a certain ritual habit? Like, what can't you go with in the morning? Like, are you a
Well, probably like a lot of people, a good cup of coffee. First thing I do is I start the coffee pot and often pick up the newspaper, which disappoints me because the newspapers are very prejudiced and biased these days. So, but it's a coffee I can't do without. I can do without the newspaper, particularly the Miami Herald.
Yeah. Well, so what's the story with Dr. Pepper?
Dr. Pepper, Dr. Pepper is something I kind of got into when I was in Texas at the Wilford Hall Medical Center. Like I got there in 1978, and just picked that up as my favorite drink. And so it's kind of become an attachment to me. All my kids love the same thing too. So when we toast, instead of toasting with a beer like other people do, or an old fashioned, we toast with a Dr. Pepper of all crazy things.
Yeah, I remember every Wednesday after the clinic day, we had to, late at night, we'd do rounds after seeing, 20 patients, 30 patients. We go through every chart. We have to make sure he has his Dr. Pepper, and then we know he's going to be happy. Now, a couple of questions to conclude this interview. They're more philosophical questions. Just would love to know how you see life and what your definition of success is. For some, definition of success is how much money they have in the bank account. For some people, it's how many surgeries they have performed. For some, it's how many accolades they have accumulated, how many plaques they have on the wall. For some, it is to live in their dream house in their dream town. What is that for you, and has that changed since I guess you started your career, or you always had your definition?
Well, like you said, success is individual. Everybody has a different definition of success. My definition of success was to raise a family, have a stable marriage, which I've had, and to be proud of my children. Again, I'm very proud of my three sons. Again, we are close today as we were. They're growing up. They have families. I got 6 grandchildren now. Thank goodness that my wife and I are in good enough health to kind of like have them beat us up literally. I think the grandchildren
I see
can be
the toys
hazardous
here. I
too.
was wondering.
Yeah, there's all my grandkids' toys. Grandkids can be hazardous to your health because they'll run you into the ground. But yeah, that's the great success that you have. It validates your life is what it does.
How did you balance that, as you're such a family man? And, it's very rare for someone to give me this answer when I tell them what's your definition of success, to say family. To me, it's interesting, and I totally relate to you in that department. My happiness is just my family to be healthy, and for me to just, my joy is, people ask me, what are your hobbies? I said, to spend time with my family. That's my hobby.
Yeah, mine too.
Besides the podcast. But, how did you find that balance, and do you wish you would have done things differently looking back now in hindsight with the experience and the hindsight knowledge you have today?
I honestly don't think I would change a bit. The balance, to achieve the balance, you have to know you have to achieve a balance.
True.
And so, again, I was lucky I picked the right wife who understood and who could basically, when we were together, it was always quality time. Whether I was with the boys out fishing or diving or with the wife on trips. Our favorite thing is to go to Africa on photographic safaris. The times we spent were quality times, and taught my children, to be independent and think for themselves. And so I'm very proud of them because they have stable marriages. They have great kids. They've never gotten into drugs or alcohol or anything that a parent would really regret and feel bad about. So it's that. It's knowing you have to achieve a balance.
I know two of them. I know the apple doesn't fall too far from the tree, and I spend a lot of time with two of them, and at Jackson Memorial Hospital. So it doesn't surprise me to hear that. So, last question that I ask all my.
1 second. This one is running out of card, so I'm gonna switch it before you.
Okay.
Do you have 2 minutes?
She's gonna
It has
go out
2
and
minutes.
collar the dog.
Well, that one is good. So
Okay,
if this one is
good,
shut
perfect.
down, that one can still record.
Okay.
Good.
Or we can switch it now. I have a second card in the slot too. I have 2 slots.
Okay. Let me cut really quick and.
Okay. Good.
Okay, take your time. She's gonna go out and.
Perfect. So, next question. Do you love your future more or your past?
Honest answer is I love them both equally. What we've accomplished in the past, great pride. The platelet-rich plasma research, the BMP, and just teaching so many quality people. It couldn't have gone any better. The future, I love the future because what I just described, of being able to do the stem cell research, which we already pioneered. We have a recent article that came out in the Journal of Tissue Engineering and Regenerative Medicine, kind of a game changer about how to harvest stem cells and what the stem cells do. So I think they're really, truly equal.
Wonderful. That's a great answer. I mean, I didn't expect any different answer. I was just curious. And which brings me to my last question, Dr. Marx.
Okay.
And I'm kind of sad that this interview is over because I learned so much, and I could pick your brain for hours. And hopefully, maybe one day I join you on a fishing trip.
You're invited.
Is there one question that I should have asked that I didn't ask?
Yeah, I can think of one, and that is, what do I think is the future of the profession of oral and maxillofacial surgery? You've dedicated yourself to it. I have dedicated myself to it. So many people I know did. I think the future is bright because, again, now it's established that we are a dual specialty of medicine and dentistry together. Nothing else is that way. We do something that nobody else can do. And between now, some of the biologic research that I hope to contribute to, and that's going on by good people today, and a lot of the technical innovations, we're going to make great strides, not only in medicine and in cancer control and cure, but in reconstructive surgery. I'm glad to see that dentistry is part of it and that oral surgery is taking the lead in it. So yeah, the future I think is bright, even though some people will argue the fact that, well, a lot of the young graduates, they don't want to take trauma call, they don't want to have hospital privileges, but there'll always be that group that will balance that out. So again, it still is the specialty where there's something for everyone. And so I think the future is very good for this profession.
I believe that too, especially with the talent that is, taking the realm, and thanks to educators like yourself. And I'm a optimist by heart, and I know there are a lot of people that there are a lot of naysayers, but it's up to the yay-sayers. Those are the ones that change things and keep the ship going. So
another question that you might have asked would be, what do you think is the biggest threat to oral and
That's a good
maxillofacial
one.
surgery? And a single word is government. A government that can mandate masks, can mandate social distances, and move to a single payer. I think every patient, every physician needs to know that a single payer can become a single non-payer. And I would conclude with that. We've seen what government has done in the last year or so, affecting the economy, where a lot of people can't afford cosmetic surgery, or can't afford routine dentistry, can't afford the insurances. I once took a 4.2 pound thyroid cancer out of a neck because the man couldn't afford the Affordable Care Act. So it's things like that bother me, because the government can mandate certain things that all of a sudden takes away from what you can do.
do you think it's ever going to change? Or is it going to get worse as far as...
I think it's going to get worse. To me, in my personal view over the last couple of years, it has gotten a little bit worse, and there is a reduction in reimbursement for a lot of things. There is increased premiums, for certain health care, which is a bit disturbing. And both political parties are at fault. Everyone will claim that the other one's fault. It's not true. It's both of them have contributed to more of a governmental takeover.
Well, hopefully someone will listen.
Yeah, the public
and
has to listen.
The public
It's
has
a
to
public.
listen. Well,
It's always a public.
thank you very much, Dr. Marx.
Well, you're welcome.
Truly
Good.
appreciate
Thank
it.
you for coming, and
Thank you.
hopefully this is something that people
Thank
enjoy hearing. Thank you.
Dr.